Good evening. Good evening, Hasika. How are you?
How are you? I'm good, ma'am. How are you, ma'am?
Yes, I'm good. So I will wait for a few seconds because I think Dr. Muto is going to speak first. First of all, I would like to congratulate once again those who passed or cleared the final FRCS exam last year. And we have some of them among us today. If you look at the number of the candidates who passed the exam, don't be freaked by Cairo exam. We have only one. I don't know why only one in Cairo. So again, this doesn't describe the overall situations. You can't make any statistics from these numbers. So Professor Moto requested me to do such meeting where the future candidates can ask the former candidates who passed the exam or even who didn't make it, so they can share their experience with the newcomers. Especially we have an exam coming soon after a few days in Bangalore. I don't know if any of the former candidates has any slides, so they can share it now. So they can talk about their experience, their recent experience, or at least some tips and tricks for passing the exam.
Hi, Dr. Gada. This is Logan here. If you mind, I can give some. I got some presentation as I promised earlier. If you have, I could share my screen if you.
Yeah. Yeah, you can share it now.
Okay. Thank you again for Prof. Mutu, Prof. Gada, and I think Dr. Kaushik is here and all the other mentors. This is a quick tips and some suggestion on my approach to clinical part of FRCS and FRCOP. I'm Dr. Logan from Malaysia. Okay. First of all, we need to define who you are and why you want to sit for the exam. I know all of you have cleared the basic part and diffraction part from the Royal College exam. Just that you need to ask yourself why you want to sit for the exam. You don't want to migrate or want to get a SAV or a job, or like me, just want to improve my knowledge and teach my fellow colleagues. Yeah. Okay. Then before the clinical exam, in any Royal College exam or local master exams, there will be a clinical knowledge for theory and MCQ exam. And this is sometimes called Part 2 or Part 2A. Okay. So I would suggest to get the latest copies of the main textbook. There are two good books. One is Kansky, another one is Ophthalmology. These are the two good books. Also, some additional short books like Wong and also Oxford Handbook of Ophthalmology. And then there are also some references, but just cautious, iWiki and Netscape Ophthalmology, and practice multiple latest MCQ books or online resources. Okay, now back to this exam, final exam, clinical and Viva. Different exams need different approaches. For FRCOP, approach same as a master exam, need to answer according to standard guidelines step by step. FRCS is different, it's a practical approach. Okay, just for tips for Viva, approach must be true and systematic. Answer confidence, you will pass. The manners are good eye contact, confidence, and smile. It will be disaster if you show any ego, or argue, doubt in yourself, or overstress. Model for almost all the questions are describe the findings, give some differential diagnosis, get some history examination and investigation to determine the cause, and then treatment and advice, follow-up, and refer. For FRCOP or master, need to follow to test the standard approach. FRCS examiner may break the flow to test your practical approach. Tips are just pronounce clearly and repeat if needed. Be decisive in surgical steps and management. Clinical, most important as you are not a paper doctor. Okay. Examiner test your clinical skills. No time for discussion. Do not repeat clinical tests. Be a good actor. Show your skills and ability. Okay. How prepare for final exam. First, there's a mental preparation. Prepare to become a student. Okay? And convince, suppose your children that you need some time for study. Okay? And logistic, exam documents, payment, visa, flight, hotel, exam format, clinical examination, and viva. Know your weakness. You may not be that good in short case or ski, need some practice skills. Strength is maybe you are good in viva. Get to know your weakness and strength. Okay, what you need? Plan your study, arrange your clinic and surgery, arrange other work commitments, plan for leave. Study partner. You cannot pass clinical examinations alone. You can always learn something from other candidates. Small group are best, 3 to 5 as groups, larger than this can lack focus. Okay. Pick your group wisely. They will be your harshest critics and hopefully become friends for life. If it is difficult to meet person, you can use Zoom. Okay. Mentor and well wishes. There are plenty in this group. Okay. This is just some tips for emergency medicine. Emergency medicine is totally a different section where we need to follow a proper guideline and algorithm. There are some books, Oxford book, either clinical medicine or emergency medicine or pit medicine. Some topics are important. Just need to know the algorithm and manage safely the patient. Okay. These are the resources for the exam. Books, notes, just can use your clinical theory exam. These two books are good. One is Fields Eye Manual and the one is FRCS Ophthalmology, the Take Walk. And study group aimed at past experience. Past experience predict what may be asked. Most important, make the most of your patients. Example, if you encounter any acute angle closure, retinal palsy, retina detachment, involutional ptosis, thyroid eye disease, infantile ET, retinitis pigmentosa, cornea ulcer, examine this patient, practice the clinical skills with this patient, and remember how they presented, what their eye looked like, and the result of investigation and management. Then later you read the topic, ask exam-oriented questions. Maybe asked in the exam. Other features, complication procedures, you can also discuss this among your study groups. Okay, finally, you cannot hide. This exam will find your weakness. Don't attempt an exit examination without adequate prior study. Work on your weakness and not on your strength. You will pass if you are solid on all stations, but fail if you are excellent on some and terrible on others. You can never fully ready for the examination. There will always be more than you know and learn. Have the confidence to believe in your abilities and remember that the real learning begins after you have passed your exam. Get enough sleep in the days prior to exam. There is nothing that you can learn in the night prior to exam that will compensate for a tired mind. Okay. And then after the exam, remember that you sit for this exam not for pass or fail, but to assess yourself. If you fail, just calm down. Failure is success if we learn from it. If you pass, thankful and reflect what you gained on your clinical practice and teach others. That's all. Thank you, Dr. Rada. Yes, that.
Thank you so much, Dr. Logan. It sounds like titles in a chapter or something like this. You ought to make a book or something like that. Very concise and to the point, and also full of wisdom.
Thank you.
I'm happy that you prepared such meticulous slides. And Professor Moto, do you have anything to comment?
I'm listening to everything, and I'm finding it very difficult. I'm actually having two smartphones, and I don't seem to be getting everything, but I'm following it. I think Logan presented it very well. Okay. What should be expected in the exam. Thank you. I'm listening.
Thank you, Professor. Does anyone else have any slides to share? Dr. Vijaya, do you have any comment or any advice regarding general medicine, emergency medicine?
since we are ophthalmologists and we are not, we have not handled these cases per se, any kind of medical emergencies we have not handled. So most of our knowledge is textbook knowledge, and we have to go by that and answer confidently.
That's a very good way of putting it. That's a very good way of putting it. Thank you. We are not physicians. Continue, please.
Okay, Dr. Koshik, do you have anything to say?
I think Dr. Logan presented very excellently. He spoke from his heart, and these are the things we expect. And obviously, if you pass, definitely try to teach others, because that's how you will retain the knowledge. Otherwise, you will definitely forget if you do not teach others.
Okay, thank you. Let's say Dr. Hasika. So so Dr. Hasika is one of my favorite candidates.
Students?
Yeah.
Thank you, ma'am.
So no, not students. So I don't call it student, but she's like it's now should be like a faculty. So Dr. Hasika, do you want to say anything?
Yes, ma'am. Actually, Dr. Logan presented it in a very wonderful way. But I want to tell just few lines about my personal journey through this FRCS, ma'am. First of all, there are many students who are attending this February exam, and people might be thinking that all those who cleared might be reading for quite a long time. I am a very busy. I am a very busy practitioner. I work from morning 8 o'clock to evening 8 o'clock, and in that busy practice, for the last 3 months only, I sat for the FRCS exam. Only probably for the last 1 month, I partially took a break from the hospital and could read. So even with less time, with good clinical experience, you can clear this exam. I just want you to, I want you to tell guys, like, don't think that you have to sit only with the books. As Mr. Logan said, as you see a patient, you keep this approach in your mind, like how would you examine if it is an examination case. So in that way, you keep examining the cases. Also read Kansky. That is what Dr. Muthu sir always used to say, Kansky, Kansky, Kansky. Read it repeated number of times. Really, that really helped me a lot. If you just sit and read one after the other, that's not going to help. Repetition is important. Read as many times as possible. Try to finish Kansky at least 3 or 4 times before going to the exam. That really
6
helps. Yes, and for me, general medicine is like a very scary thing. I kept on postponing it till last 15 days before exam. I used to listen to only Dr. Vijaya ma'am's classes. But what helped me is her one day while I was traveling, I actually logged into one of her presentations when she was telling. So those slides which I took the screenshot, along with YouTube videos, see whatever, suppose there is a case of acute MI, I used to go through YouTube and I used to press a video, short video about MI. So what we need is we don't need everything about that case. How it presents, how should we manage is all what we need. So instead of reading the books, when we see it, we remember better. So I saw a couple of YouTube videos in the last minute and made a short notes about it along with ma'am's slides that helped me a lot. So I'll share a couple of videos which I felt useful in our group. So I hope it will be helpful for other people too. So this is what I and of course Wong book. I'll share that book also in the group. That helps us to give an idea how to approach a case of any case. How to approach a case. It's not just a textbook language. We have to talk to the examiner like a consultant, not like a student. So how to approach is given in Wong book very clearly. So these are the tips I thought I should share, and that's it. If anyone have any doubt, you can ask at the end of the class. That's it, ma'am. Thank you, ma'am.
Thank you, Dr. Hasika. Thank you so much. So Dr. Shansini. So forgive me if I messed up your name, but can you say anything? Dr. Shansini.
Hi, hello, Dr. Gada. Hi, Dr. Gada. Can you hear me?
Yeah, very clear. Go ahead.
Hi. Thank you so much. Thank you so much for arranging this. Thank you so much for allowing us to be a part of this presentation. So I just wanted to thank this group, Muthu sir, and all the mentors, you, Dr. Gada, and Dr. Vijaya. So and Dr. Kaushik. So all the many classes that were taken in this group. So joining this group was really a blessing for me actually, because um, I was working. I mean, I am a consultant in Chennai, and then I have a practice. I mean, most days I work full days, just like how Hasika was doing as well. And apart from that, I have twin boys, and then I have to take care of them as well. So I could not get a big break, a long break to sit and breathe. But then what I found was, I would want to give that as well as a suggestion to the other candidates for preparing. Don't take a huge break to prepare for the exam. Every patient that you see in the clinic, start like examining them like how you would do in the exam. Like have a format, like how you would practice, how you would examine each patient, like so that you don't miss out on any part. Like some people like forget to lift up the conjunctiva to see the superior bulbar conjunctiva is a frequently missed site. So and the medial canthus, and like make it like some sort of a format what you can follow for every patient. That I think would help. And the more cases you see in your OPD, the more confident you would be when you would actually giving your clinical examination. And Kansky, Muthu sir, from the starting, from when I joined the Muthuswamy group, from the for day one, Muthu sir kept insisting on Kansky, and that was all I read. That was all I read, like twice, thrice, I think 3 times. I think I read Kansky. That's I could not read more than that, but that really helped me. I mean, whatever clinical knowledge and whatever theory knowledge as well, Kansky was really useful. And books like Cakewalk and Wong that Hasika was mentioning about, those books come in handy as well. I mean, that will give us an idea as to how to present that, and like how you present a case, like how to sound confident, how to say the right words. Those books help as well. And having a study partner, like Dr. Logan explained, I mean, had put it across in his very concise and precise presentation. Having a study partner would really help. I mean, like you help another person and they help you. I mean, something which is easier for you. You can help your partner, and whatever that is their strength. If it is not your strength, they would be able to explain to you as well. So, like, some people might be retina specialists, some people might be cornea specialists. So, I mean, you can share your respective stream, and that would you can mutually benefit each other. And that helped me. I had a study partner, so that helped me as well. So that is one other thing. And also Muthu sir and Vijaya ma'am kept sending questions. I mean, like they were emailing questions. The Muthu sir started from like right from chapter one, right from conjunctiva. He started one question for each chapter, and then he gave me a clinical scenario, and he asked questions, and I had to give answer to that. I don't know if how many of the other candidates got that experience, but that was really useful for me. I mean, like going through that particular case, like as of how I would presenting in my examination and how I would give the management and the treatment, that really helped me. So I would suggest that if you would please request sir or anybody else who's your mentor for this journey to give you case scenarios where you can give answers to them, like how you would be doing in the clinical examination. And Vijaya ma'am gave the whole very nicely. Vijaya ma'am gave every lot of questions she gave us. Me and Ramya and I were and Sonia as well. We were answering all of Vijaya ma'am's questions in every chapter of medicine, which would be likely discussed in the examination. She gave us those questions in that, and we had to answer it. And she very meticulously, Muthu sir and Vijaya ma'am, they went through our answers very meticulously, and they gave us like really proper like they told us what we could do better and what we did correctly. And Muthuswamy sir and Vijaya ma'am, they were very positive. So many times when I felt very discouraged, reading their emails really uplifted me. And Dr. Gada's messages, just keep in touch in the group. I mean, Dr. Gada keeps sending all these really nice messages, which makes you feel so good. I mean, when you're preparing for a FASTS exam, it is not a very easy thing. I mean, we all have other things to do, and it's difficult for us to find time. And very often we might feel very down and out. But then, like going through these messages and people are just there for you to, for to make you feel better and to encourage you. So that I feel is a very important part of being a part of this group is all the encouragement that we got, and really make use of that. And just before the exam, I would say, relax. I mean, there's only so much you could do. You can't do anything beyond that, and just relax and make sure that you get a decent sleep the previous night, eat breakfast and lunch, whatever the meal that is there before your exam, and make sure that your mind is calm before you go for the orals, especially because like things that tends to just escape out of your head at the moment where they actually ask you. But then if you just stay calm and just think, it might just come back to you again. So I think, and pray more than anything else, it's all from the hands of God. So I thank you so much, Muthu sir, for making this group, for creating this group. It was really a wonderful blessing to me. And thanks Dr. Kaushik and other mentors who kept giving regular presentations in the group and attending each one. Like I don't know whether the other we had like every particular chapter we had a presentation. So that was really useful to listen to those. Even if we could not be actively participating in the Zoom meetings, we could go back and see the recordings, and those were very helpful to us as well. So I would say keep in this group, keep in touch, and keep asking questions. And then don't be afraid to ask questions if you're not sure of what is being discussed in the group. So that's all I think is from my side. Thank you so much.
So I can't get enough from you, since you have a unique style in writing and speaking. So you can keep going. So we never feel bored or something like this. Thank you. Thank you so much.
Thank you so much, Dr. Gada. Thanks a lot.
Okay. So I don't know if we have any other former candidates. I don't know if I can ask for those who didn't pass, but as Dr. Logan say, failure is not failure if you learn from it. So it's just a lesson, or a failure is a step in the learning process, actually. So if you remember, I don't know, but last year we have a Zoom meeting with one of the candidates who didn't pass, actually. And he was so brave to share his experience, and it was like very helpful. And so the Zoom meeting was all about him and his experience. So even if you didn't pass, you can share your experience, even in the written way. So you can help others while helping yourself to pass the exam. Okay, so while you are thinking, if you remember, I posted this poll question on WhatsApp. So there was a point behind posting this poll. And if you noticed, so reading the past experience is a very helpful tool while you're preparing for your exam, especially if you are get bored of reading chapter by chapter, or if you already studied chapters. So because if you read experience, it's like a mix of all questions. And some candidates really wrote their experience meticulously. So they wrote everything, including the recommendation. So I am the only one who voted for the acknowledgement section. So there is parts for the ideal experience. It should be starts by acknowledgements. So if you remember, if you are reading a book of something like this, there should be a section for acknowledgement. Apart of from the importance of showing you how you are grateful for those who help you, but in the acknowledgement section, you will find some resources. So if you have read some Shoah experience, you will find that in the acknowledgement section, they mentioned special website, special books, not special books, special website, and also they mentioned our university as well. So don't miss the acknowledgement section, and show your gratefulness to your family and friends as well. And of course, the recommendation is helpful. Question asked, case presented. So I noticed that in some experience, I don't know the benefit of describing the examiner's nationality. some, I don't know if I read that in Cairo exams, there is a lot of Egyptians and Jordan. What is the benefit of knowing this? I don't know why, but some people like to write this in their experience, but I don't think it's helpful. And be aware of the tone of writing. So don't be freaked by some experience. Make the best of each experience. You take the positive parts, because some experience actually have some negative messages. All right.
I agree. I totally agree with you, Gora. I totally agree with you. No point in writing all those negative things. It doesn't help anybody.
Yeah.
Be positive. Be positive in life too.
Yes.
It's very important.
And as Dr. Logan said that you have to study alone sometimes, especially in the beginning of your studying process, and maybe at the very last end. But study groups are really important because you are practicing each other, so you can help each other. So you can know your weakness from the judgment of your study partner. But of course, you have to get a loyal study partner. Okay, we have Dr. Sana. So she just joined us. So again,
Yeah.
Sana is one of my favorite learners. Can you say something, Dr. Sana? Like,
yes.
Yeah, go ahead.
Yeah. Hello, everyone. And thank you for the great introduction. And it's an honor to see actually Professor Muthu sir and hear you. And I would really first use this platform to thank Muthu sir and you also, ma'am, and Dr. Vijaya, for all the incredible help that you have given us. It was really very, very helpful. I have no words to express all that. So in addition to what Dr. Shantini told, I just joined that time when she was, I think, about to finish or something. Actually, this group is really, really very helpful. Each and every assignment that Dr. Gada used to send us was really helpful. I came across most of these assignments in my exam. I was asked at the station actually. So I had already performed that because I owe it to Dr. Gada. She had given us assignments and I used to record the videos. Although I was at home, I had some issues. I had some medical issues and I was at bed rest also actually for a few days after filling my form, and I was totally broken. Actually, I thought I will not appear the exam also. But then somehow with the grace of Almighty, actually, I completed my physiotherapy and all that. And then when I started looking into the group, I found that Gada ma'am is sending us a lot of assignments, and I was taking up every assignment and I was doing that and sending my recordings in the group. And I learned a lot from that. So the basic point here is that you need to learn from your practice itself. So you cannot learn from others. You have to learn from your own mistake. So you will learn only when you do it, when you perform it. So it's very important to practice. Practice is the key for passing this exam. That is what I felt. So I'm sure that we all are very good at theory part, and we all know what to read also, Kansky and all other books as suggested. But the practical knowledge is very important. That is what they are actually looking at us in the exam. They're not just testing our theory knowledge. They are also looking how you approach the patient. So that is very important, and that comes only with practice. So in your daily practice, like you're seeing an OPD, you have to go there and see the cases. That is what they judge you in those 12 minutes. It's a very short span of time. You won't even realize how your exam got over. Actually, it's such a very fast, the time runs very fast over there. So it's just like you have been in your normal OPD, but you should be in practice of doing that from the beginning. Then only you can perform it on that day. Like you cannot fake things over there, because it's not possible. They will just catch that. So I would suggest all the candidates who are going for exam to start practicing whatever cases they are seeing. Practice with the proper protocol, the examination techniques and everything, and need to practice that. That's very important. So that is what I learned from doing Gada ma'am's assignments actually. And she has given very, very useful, and I think it is available also in the group. So I would suggest everyone to go back and look at all the assignments. They are very helpful. And also Muthu sir has sent us many questions which I used to write and send and get the corrections feedback from him. So that was also very helpful for me. I used to cover the entire chapter in that from Kamsky. And Vijay ma'am's emergency questions also helped a lot. And apart from that, you really need a good partner. So I was lucky to have my husband, Dr. Naveed, and we both used to practice, and we both cleared the exam together in September at Delhi. So I had a sincere partner actually with me day and night. Even if it is not there, I would suggest that you try to imagine that somebody is observing you, time yourself in the OPD, your examination techniques, and whoever is available with you, your colleagues or your juniors, your seniors, just practice. That's very important. That's what one message I would like to give actually from my side.
Thank you, Dr.
Yes,
Sana. Thank you so much. So because we have newcomers here who just joined the WhatsApp group, so they don't have the access to the old messages, the old assignments. So be assured, I will send it soon. I will send for the newcomers, Dr. Nihal and Dr. Arisha, and those who just joined the group, I will send these assignments. So these assignments is all about clinical examination techniques done by the candidates themselves. So don't worry, I will send it again. And this is one of the limitations of WhatsApp because you don't have the access to the old messages. Dr. Verma just joined us, or just to speak.
Oh, hi, Dr. Kada. No, I don't have any presentation, PowerPoint presentation.
So you can speak like others, no problem.
Yeah, almost everything has been covered already. But I would like to mention only one thing here, that like small things you can miss in the exam, right? Because there's an exam stress and your heartbeat is racing. So these things like when I came out of the exam and we discussed the 4 candidates which gave clinical exam with me, they were not in the group. So I discussed with them what happened in the exam, and I found out that they did not, they missed adjusting the slit lamp. So I think the first thing you should do when you sit on a slit lamp is adjust the IPD and the eyepiece, because these are the small things that they are looking at. They're not looking, to jump to the diagnosis and management. They are looking at your process, how you see the patient. So even if you are using an indirect, direct 90D, I think the correct technique and small things really matter at that time. So this is the one point I think I would like to mention here.
Thank you so much. Short and sweet.
Yeah.
So does anyone have any other tips or advice?
I want to add something to that.
Yeah.
No examiner wants to fail you. Please remember that. You don't come out and say the examiner failed me. In the training of the examiners, they are trained to pass the candidates. You'll be very surprised. Am I right? You don't come back and say, I was failed, I was what do you call, victimized and all sorts of things. Nothing. The examiners want to pass you, full stop. You also go with that feeling, that attitude, the chances are you're going to do well. Remember that, okay? No examiner wants to fail you. I know for sure.
So we have to focus on the questions, not the examiners. So don't mention the nationality in your experience. So I hate this point. So focus on the questions, study them properly, and you will pass. For those who don't know Bloom taxonomy, so it's like it's not all. So remembering, just recalling the information is just the level 1. So the proper exam format should tackle all these levels: understanding, applying, analysis, evaluating, and creating. So actually, during those who attended the mock exam practice, we did 3 lectures so far. I put this Bloom taxonomy in my mind while preparing the questions to test everything, not only the remembering aspect.
Dr. Gada, this is Hasika.
Yes, Hasika.
If there is any chance, can you ask if any other students who are approaching the exam have any questions to ask us?
That's it. That's better.
Okay, let's see. So we have to call each one by his or her name, because let's see here.
Those of you going for your exam, ask any doubts.
Yeah, I know them. So Dr. Sahana, so you are hiding behind your phone number, but I know you. So do you have any question?
Hi, ma'am. Good evening.
Good evening.
Ma'am,
Yeah.
I just want to know the examination techniques because some of the videos, it's very different from one another. So especially the pupil examination and field examination.
So Dr. Hasika, answer her.
Dr. Gada will be sharing wonderful videos in the group. I think if you practice those methods on your patients, that will definitely help.
I will
I
send
think,
them. Yeah, I will send
yeah,
them.
we missed that message probably.
Okay. Okay, sure. Okay, sure. Thank you.
Dr. Deepika, do you have any question?
The same one, ma'am. I was going to ask which video to follow. I mean, pupil examination, we have been doing it for every forever, but doing it correctly, as in I look at 3 different videos, I see 3 different techniques. So which one would be ideal and so I was going to ask the same question actually.
Isn't there anyone in your department who can do a proper pupillary exam? You don't have to go watch all these videos. There must be somebody in the department who can guide you.
I work I'm into private practice, but I'm into my own practice. So I'll have to work with some professors or somebody else.
Okay.
So Dr. Deepika, we have a books about the proper way for clinical examination. So I will share them. So usually you need sometimes, if you don't have a role model in your work, who knows everything about clinical technique, you can refer to the books. Sometimes not all the videos are correct because some of the videos are general and directed to the all eye care provider, not only ophthalmologists, but also optometrists. So optometrists, sometimes they have your style in examination. So I will send some books regarding the clinical techniques, and I will send the videos we did before. So you think so that you are stressed about you are afraid of clinical examination because you have to do it properly. Yeah.
Yes, ma'am. What happened? This is the second time I'm appearing for the exam. Last time, I realized later on that in my orbit and oculoplasty station, I asked to elevate the lid of the patient, retract the lower lid of the patient, and the patient winced. So that I think, I did not realize at that time that, while I was doing the evaluation, but then I realized that it's a big no-no. Actually, you're not supposed to cause any pain to the patient or inconvenience them. So actually, that kind of thing, actually, I think my answers might not have been up to the mark, but that particular thing, the patient's this inconvenience, it might have disqualified me. So that is why I'm looking into doing it better. Actually, clinical examination, I do it properly so that I don't face the problem again. That is what my issue is.
Yes.
Okay, thank you, sir. I have another question. In the Viva exams, when presented with photos, with pictures, do we ask the question, what do you see, or describe what you see? I feel, okay, this is my second time going for the exams, and I felt I made certain mistakes in the Viva. I felt I didn't describe, for example, I remember I was presented with a fundus photograph, and I went straight to just describe what I was seeing. But then later I was feeling I probably would have described, okay, this is the right eye fundus photo, or maybe look out for the details of the patient first at the corners before now describing the main photo. So I really don't know what is expected when we're presented with a photo first. Do we just go straight to describe what the signs we're seeing there, or begin by saying, oh, it is a fundus photograph of this, or it's a visual field test of so and so taken on so and so date? I want to know.
Hello. Yeah. Can I give some comments?
Yeah, go ahead, Dr.
Yes, sir.
Logan.
Yeah, just that, just now, Dr. Bako, you need to buy some time, maybe 2 or 3 seconds for you while your mind is thinking to the differential diagnosis and you want to come, what are your plan to answer the question. So when you start with, you can tell that this is a fundus photo of the right eye. You are looking at this 2 or 3 seconds will buy you some time in your brain to think about the differential diagnosis. What are you going to tell? Because in Viva, every single word counts, you know. So you have to be, so these 2 seconds, when you describe this, it will, in your mind, you can have a more clearer answer.
Okay, okay. Thank you, sir.
Good suggestion. Very good suggestion. Very good suggestion. Mhm.
Okay, Dr. Charlin, you are appearing soon to the exam. So do you have any question?
Yes, hi, Dr. Gadar. I was just wondering how many clinical aspects could you miss before actually feeling the clinical station?
So while you are thinking about failure, so you try to be positive. You are thinking about the failing mark.
Yes. Yes. No, I'm just assimilating the information. This is my second time as well. And I had fallen in the OSCE, the Viva part wasn't a problem for me, although I felt I had made some mistakes there. I had passed the entire Viva, but my weak points were in the posterior segment examination, as well as neuro station. And maybe my neurology examination was not as smooth. I had to do a cover test and an ocular motility test. And in the posterior segmentation, I had a bit of trouble with the indirect, and the patient seemed not to be following instructions. So I believe that might have made me fall there. But in part of the posterior segmentation, I believe I got a laser scar, and I mentioned something about retinitis pigmentosa, but I said everything with respect to the follow-up questions there. However, I failed the station in spite of, so I was just wondering, at that particular station, I couldn't figure out what might have gone wrong.
Okay, I think you have to work on your weakness. So as Dr. Logan mentioned in his presentation, you know your weakness, so work on it. So if you are having trouble with indirect ophthalmoscope, you have to practice more. You maybe missed the signs. So you answered the follow-up questions, but you missed the primary signs, the clinical signs, or you probably misdiagnosed the case. I don't know what happened, but so don't think about what is the failing mark. Stay focused and study and practice. That can I will say. I don't know. Let's see, Dr.
Okay, thank you.
Yeah, I wish you all the best. Dr.
Thanks.
Yeah.
So
Listen to the examiner. Listen to the examiner.
So can I add one point, sir?
Yeah, go ahead.
Yeah, so regarding his first question only, like Kansky pictures are definitely helpful. You have to, when you're reading, see those pictures. But in our case, when I appeared for the Viva exam, not even a single picture had a classical presentation. Very atypical presentations of, so for example, there's a fundus photo of melanoma over a disc or close to the disc. It's a very atypical presentation. Sometimes you might not understand what actually it is. So like as Dr. Logan said, you start describing the picture for 2 or 3 seconds, like this is a fundus photograph of a right eye, or it's a colored photograph. Keep thinking about what you want to tell. That gives you time. Try to describe the lesion. Even though you don't know a proper diagnosis, definitely examiners will always try to help you. They'll give you leading questions like, what do you think? What do you think? They always try to help you and bring to a differential diagnosis. That is what I felt. Every examiner for every question, they try to like if you are going out of the way, no one can help you. But if you are close to the approach or diagnosis, definitely they'll give you leading questions to come to a final conclusive answer. That is what I felt.
Okay, thank you, Dr. Hasika. Dr. Arisha, do you have any question? Arisha.
Yeah, good evening, ma'am.
Good evening.
I just wanted to ask, like, if we describe the findings, if we are saying the Hirschberg test, do we need to see that we are making the light falling on the glabella? Now I see the reflex, or we directly say that it's the Hirschberg test is orthophoric or iso, or how do we describe? I mean, do we need to describe the technique, or we directly tell the findings of our findings?
You're asking about the clinical station, right, Dr. Arisha?
Yes, ma'am.
Exactly, sir. As you're doing that examination, now I'm like, you can describe what you're doing and tell I found this. Suppose you're now I'm shining the torch on the patient's eye. I can see there is a mild, the eyes are orthophoric. That is how you have to do. I mean, like, you have to explain what you're doing and give your interpretation about it.
And be aware, Dr. Arisha, you have to explain the procedure to the patient himself or herself. You are giving instruction to the patient. So the examiner is watching this also. Okay?
Oh, okay, ma'am.
Dr. Pooja, how are you? Do you have any question?
Yeah, hello, ma'am.
Hello, yeah.
I have just started preparing for the exam, and this session has been very helpful. Till now, whatever doubts I had, most of the questions are answered in all these talks till now.
So the remaining part is to study.
Yeah.
So Dr. Rama, do you have any question?
Hello, ma'am. Yes, ma'am, I have this question regarding we come across many studies while we are preparing, like the recent studies, or say in particular to any diseases like glaucoma or anti-VEGF studies, or the hepatic eye disease, ma'am, which you previously mentioned also in our previous talks. So how important are these, and how detailed are we supposed to know about them?
Just remember,
and
just remember,
yes, ma'am.
Rama, it's part in your curriculum. So view trials or studies as a chapter in your book, because this is a kind of evidence-based medicine, and we are trying to apply the best care for our patients by imitating what others do according to the evidence-based medicine.
Yes. Ma'am, sometimes it is like we are probably using that kind of management which has been studied and proven, but sometimes we are not able to name which exact study this was proven in. So that is there. Have to remember that way, right?
So as long as
another thing, yes, ma'am, please.
So you are knowing the guidelines. So just you don't know the name of the study.
Okay.
Yeah, I think it's not necessary to know the name of the study sometimes, but you have to follow the general accepted, like the preferred practice pattern for such a condition.
Yes, ma'am. Okay.
And again, Rama,
okay, sir, yes.
So reading the past experience will help guide you to which study is important study, which one is you have to know it. So last year they were asked about the EAGLE study and also the herpetic eye disease study.
Yes, ma'am.
Hello, ma'am.
Yeah, Sana, go ahead.
Yeah, I would like to add on this that I was not asked about the studies, but Dr. Naveed was asked about the studies. That is as you mentioned, the EAGLE study, because we during Viva we got a case regarding angle closure glaucoma. So the examiner directly asked that, do you know any studies regarding this guidelines for management? So he was asked about that study, and yeah, that's it. And I think DRCR studies and trials were asked actually for me, not details, but just they wanted to know the guidelines, whether I know about that. That's it. So it was asked for us actually.
So I think, doctor, some of the questions like a few questions are like target about the updated medicine. So they want to know if this candidate is aware of what is happening recently, right? Yeah. So that's why if you have an old book, like more than 5 years, be cautious. So try to update your references, especially for tumors, because there is an advance in the chemotherapy. So, for example, don't rush for inoculation and like exenteration of. So this is like invasive line of treatment. There is some advance in the oncology, not only in the vitreoretinal, because in vitreoretinal and refractive, we have a lot of advanced techniques, but also in oncology. So be aware of the updated lines in the management of tumors. Okay, so let's say one last advice, because Bangalore exam going candidates are very stressed now. I think by the end of this meeting, they are very stressed. So can you give them like a piece of advice how to relax and to be focused in, because this is a critical time before the exam. So they
wish everyone the very best. Let's hope all of you will pass.
I think they should take a leave. So to concentrate more now because they have like a few days.
Ma'am, I have one last point to say to the exam going students. May I?
Yeah, go ahead.
Dear exam going students, it is not possible for everyone to do excellent in each station. Okay, sometimes at that point you will not remember anything, and once you are out of the station you'll remember all the points you wanted to answer. So this happens to everyone. Don't carry the disappointment to the next station, because you have to be, the exam happens in a very quick manner. Okay, from one station you have to move on to the next station. So even though if you have not done well in one station, just leave it then and there, go to the next station, try to do well again. Okay, so please don't carry the disappointment at all. You will think you didn't answer well, but ultimately you'll be doing well. So all the best, guys. I hope all of you will pass in the coming exams. Thank you.
Thank you. Thank you so much.
Hello, ma'am.
Yeah. Hello.
I would like to just share my experience regarding the question of non-cooperative patients or patients who are not cooperating during the examination. So I had one patient in my posterior segment. My first station was posterior segment, and my patient, it was in the second part of the day. So the pupil was already constricted, and they asked me to do IDO, and the patient had a lot of watering from the eyes actually. She was squeezing her eyes very badly. So I conveyed that to the examiner that pupil is constricting, sir, and I think it is causing her trouble. The light of that IDO is causing, but he insisted that no, you continue. So I tried to be maximum polite as possible and gentle as possible. I even requested for a tissue paper so that she can so that I can she can wipe the tears off and the watering, whatever. And then I reduced the intensity of the IDO. I made again adjustments, and I reduced the intensity of my IDO light, and again I examined, and that time she was cooperative. So she opened her eyes actually, and I could see some findings, and I told. So I was the only person in the second part of my in my batch to examine 2 patients only in the posterior segment. All others examined 3, but I was the only one to pass. So I think what is important is you have to be gentle to the patient, as sir told, and it's not a number of patients you see, but how you see the patient, that is more important. So I took some time to adjust the IDO and all that. So my time wasted in that actually. That's it.
Thank you, Dr. Sana. Thank you so much for this advice. I think Professor Moto, yeah, Dr. Logan,
I
yeah.
just want to add, yeah, it's a very good advice. Actually, light could be very painful for the patients. So that is why preferably for pupil examination, use yellow light and don't use the bright LED light. And the second thing is that for the both slit lamp, try to use the neutral density and always start with the low to medium illumination. Same to with binocular indirect ophthalmoscopy. Do not use a maximum light. Same also to direct ophthalmoscope. Do not use the maximum light. Try to use a low to medium.
Okay, thank you. So, so the bottom line is that once you have like a problem, try to think out of the box. Yeah, don't freeze. So as Dr. Sana mentioned, she didn't give up. She didn't give up. So she some rest or tissue and decrease the illumination, and she managed the situation. Don't complain and stop examining. Keep thinking and re-examine the patient. I think it's hard to be gentle with the patients unless you are gentle with the real patients. You can ask your colleagues, ask them about your performance with the patients, the real patient in your clinic. Are you gentle or not? It's hard to be acting all of a sudden at the exams. You have to be gentle and respectful to your patient in the first place before going to the exam. Just remember, they are human like you, not a robot or something like this. I always say this before. I said this before. You can fail the station, but don't fail the encounters. Try to win the situation regardless of the results. Regardless of the results. So be respectful to the examiner, to everyone, to the patient, and that's it. Prof. Muthu.
And one more thing: if you are not from that country, and after the exam, also spend some time visiting the place. Like for me, I visited Metro in Delhi, which is very nice, and also I visited Museum of Delhi, which is also nice. Yeah, so do spend some time after exam.
Okay, so this is like a post-exam advice. Try to relax, enjoy the trip, the journey. Okay, come to Cairo. All right. Thank you for attending the meeting, and I hope you found it useful. And I think it is. Especially we have this is the first time to meet all those number of faculty staff. I'm feeling proud. Goodbye and have a good
night.
evening.
Thank you, Dr. Gada.
Yeah, good night.
All the best, everyone. Thank you.
Thank you.
Thank you very much.
Thank you. Thank you very much.
All the best, everyone.
Thank you, ma'am. So
Thank you, ma'am.
soon we'll celebrate your success. Sooner or later, you can do it. Bye-bye.